Good evening and welcome to Supporting Mental Health, a Council virtual town hall meeting. Thank you for joining us. The purpose of this virtual event is to get feedback from residents about mental health issues and highlight available resources. We invited mental health professionals and community partners to address issues and questions from community members. We kindly ask that you mute yourself when it's not your turn to provide your views. Also, just a friendly reminder that we have more than 250 people registered for this virtual event, and we ask that participants who are giving live remarks are aware of your allotted time to speak and be respectful for others speaking after you. Participants on the Zoom may also view Spanish captioning by selecting the closed captioning button at the bottom of their Zoom screens. This will be button marked as CC in capital letters. We have Marcela Rodriguez on the Zoom for residents who may need interpretation services from Spanish to English. Marcela?
Este programa se está traduciendo al español para los participantes en Zoom. Usted puede acceder a este recurso seleccionando el botón CC en la parte inferior de su pantalla de Zoom. Jordan, back to you.
Thank you, Marcela. Now I'm going to go ahead and toss it to Council President Gabe Albornoz for his welcoming remarks.
Thank you so much, Jordan. What a privilege and honor to be with all of you this evening. I am the Montgomery County Council President this year, Gabe Albornoz, and also Chair of our county's Health and Human Services Committee. The council every year hosts 4 town halls. One of those is a standing town hall for our youth, but the other 3 are at the discretion of the council. And my colleagues unanimously supported selecting the topic of mental health for tonight's town hall. All of us in our respective offices have received just terribly sad and overwhelming constituent calls from residents at all socioeconomic levels, from all generations, and from across our entire community. This last 2 years has impacted all of us in ways that are truly unimaginable and have disproportionately impacted our especially vulnerable populations. But all of us have sensed a sense of loss and trauma in these last 2 years. We have missed weddings, we have missed milestone events. We celebrated my dad's 75th birthday through a side door of my parents' home. And my grandmother, who passed away in the midst of the pandemic, not of COVID, but we were unable to grieve together as a family in the way that we needed to. But my family did not experience even close to some of the loss that has been felt by so many. But this sense of overwhelming exhaustion, this sense of confusion, this sense of disorientation, of not feeling in control of what's before us, is something that all of us have felt. And the weight of it has had profound impacts on our entire community. It has disproportionately impacted our minority communities, and it has also disproportionately impacted our vulnerable communities, such as our disability community and our aging community as well. We collectively as a community must come together to address these issues and break the stigma that is often connected to mental health. So we are fortunate and blessed in Montgomery County to have some of the most amazing organizations and professionals right here that are on the front lines providing support and love and assistance in ways that are truly remarkable. And I want to now list our panelists this evening. This evening you will be hearing from Dr. Raymond Kroll, our Director of the Department of Health and Human Services, and serendipitously, the Chief of Behavioral Health within Montgomery County, and a trained psychologist who has been steadfastly leading us through this extraordinarily challenging time. We also have Ms. Helga Luest, Chair of the Mental Health Advisory Committee, Ms. Susan Karen, the Vice Chair of the Mental Health Advisory Committee, Karishma Sheth, Chief Program Officer for EveryMind, Johan Urgela, Manager of Counseling Services and Mental Health Therapist at EveryMind, Felipe Milan, Hotline Specialist at EveryMind, Samishka Sabkota, Behavioral Health Program Coordinator at the Asian American Health Initiative, Diego Uriburu, Latino Health Steering Committee member for the Latino Health Initiative and Executive Director of Identity, Ms. Arlie Wallace, Program Manager for the African American Health Program, Dornay Hill, Manager of the Department of Health and Human Services, Behavioral Health and Crisis Services, Monica Martin, Senior Administrator, Department of Health and Human Services, Child, Adolescent, School, and Community-Based Services, Viviana Azar, Manager of the Department of Health and Human Services Child and Adolescent Behavioral Health Services, Everett Davis, Acting Associate Superintendent, Office of Student and Family Support and Engagement at Montgomery County Public Schools, Christina Connolly Chester, Director of the Department of Psychological Services at Montgomery County Public Schools, Lindsay Cow, Coordinator of Student Wellbeing and Achievement at MCPS, and Ms. Stephanie Rosen, Executive Director of the National Alliance on Mental Illness in Montgomery County. I want to take a moment to thank all of you, our professionals who have been on the front lines addressing the behavioral health needs of our community. You are all exhausted as well, and I know overwhelmed, and the caseloads are unimaginable right now. We know that we are hemorrhaging behavioral health specialists at all levels across our community, and that we are struggling to fill vacant positions. I want to thank all of you and hope that all of you are taking the time to care for yourselves. And that ultimately is what tonight is all about. We have to take care of ourselves, and of course, by extension, our loved ones and our neighbors and the folks that work in our offices. There is help out there. None of us are alone, although some days it might feel like it. And so I look forward to tonight's discussion. The goals of tonight are to break down the misperceptions about mental health issues and promote recovery and a healthy community as a whole, to help find innovative community-based solutions to mental health needs, and to develop the next steps for our community to address mental health needs that complement existing government services and the outstanding work of our existing community partners. Over the course of this evening, you will hear from all of my colleagues on the council who are steadfastly committed from every angle imaginable to tackle this issue, whether it's establishing policy, supporting funding, or just generally helping with constituent services. We are here for all of you, and you are part of us. So I now want to introduce two of my colleagues on the council, and again, over the course of the evening, you will hear from all of us. But next, I want to introduce our Council Vice President and also member of our Health and Human Services Committee and lead for vulnerable and homeless populations on the Council, Council Vice President Evan Glass.
Thank you very much, Mr. President. Good evening, everyone. And I want to thank you all for being here with us for this really important conversation. Over the past 2 years, the pandemic has stolen so much from us. It's taken our sense of normalcy, our sense of safety, and our sense of community. And in these difficult times, we know that the pain that many of us have been feeling might not be visible. Some of us went a really long time without seeing or hugging a family member. Some of us lost loved ones during the pandemic. And we went a long time without hanging out with our friends, laughing with them. And many of you missed important milestones like homecoming, graduations, weddings. The bottom line is that none of this has been normal, but all of this has taken a toll on every single one of us and on many people's mental health, but especially our young people. And I've heard from parents concerned about their child's mental health, and I've heard from students worried about themselves and their classmates. And it is undeniable that we are in a mental health crisis. And our response as a community needs to match the crisis that we're in. And that's why I and all of us in county government remain committed to ensuring that we provide the needs of the community and that we have a budget that reflects those needs. Now more than ever, we have to establish safety nets that support the well-being of every single resident in Montgomery County. And with that, I look forward to tonight's important conversation. I yield back, Mr. President.
Thank you, Council Vice President Glass. Again, over the course of the evening, you will hear from all of my colleagues. Next, we will hear from Councilmember Nancy Navarro.
Good evening, everyone, and thank you for joining us. I think I can associate myself with my colleagues' comments that this has been really, truly extraordinary times. And we knew right away, March of 2020, that we were going to be facing something so extraordinarily unprecedented. But at that time, we really thought it was only going to last a couple of months. And we all know, because the research shows that whenever you have a extended period of time when you are facing trauma, when you are facing challenges, when you are facing loss, that has a real impact. And there's no doubt that all of us have been really focused on keeping everyone safe. But part of that safety means that we also have to tend to our mental health, to our emotional health. And I remember just being so pleased to hear feedback from our residents about how, for example, the parks provided such a respite. Everyone was looking for ways to find that type of respite. But we also know that especially for our young people, we do need to respond very quickly and bring into the school system, in particular, resources that can be readily accessible. So I just want to share that, we all have been discussing this for quite a while. Our Health and Human Services Department, our partners, we have been working on so many of these issues, but I know that this is definitely a different time, and it requires for us to act in different ways to quickly stand up those best practices that we know have worked, but now we need to scale up. So as my colleague said, I think through this budget, we will be looking at some significant proposals to just do that and be ready to respond to what is happening out there. So again, thank you so much, and I look forward to hearing from all of you.
Thank you so much, Councilmember Navarro. Next, we will hear from Dr. Raymond Kroll, our Director of the Department of Health and Human Services, and then I will turn it back to Jordan to help facilitate the listening session from there. Dr. Kroll.
Thank you, Council President Albornoz, and thank you all and the members of Council for doing this forum and for inviting an incredible group of people here tonight to talk about mental health and our healthy development in this county. You have all talked about the issues that COVID has brought us in terms of stress and anxiety and fear and uncertainty and anger over the last 2 years. All of our emotions are on full boil. Like many people in the audience, I've lost family members and friends to COVID over the last 2 years and have not had the pleasure of or the comfort of grieving with them in person because of this disease and or connecting with them. So it has taken a toll on myself and on my family, but also on what I know about that is in this job is that what I experienced is something that many people, thousands of people across this county have gone through, both in terms of losing parents or children or elders or spouses in the last 2 years. But this problem with mental health didn't start with COVID. This has been a long time in the making, and our capacity to support mental health has been waning in this country for a lot of different reasons that we may be able to talk about tonight. I am excited by the fact that Montgomery County and the council are folks who have always had better resources and good resources, but I would say that it has been insufficient to the task. But in the last 2 years, the work that council has done and the county executive has done has enabled Health and Human Services to begin to grow and build a stronger mental health system. I would still say that it is insufficient for the task in front of us right now, and that we have to think about creative ways to expand and grow and promote the mental health and well-being of all of our residents. I am a positive psychology person. I think about wellness and healthy development, and yet so much of what we do is predicated on not being able to work with people until they come through our door with a major mental illness and a diagnosable condition that we can treat and that the state or the federal government will pay for. We have to think differently about mental health going forward and think about all the pieces that contribute to the health and well-being of someone and all the things and build those up and recognize that there is a developmental process that we all go through as human beings that will leave us healthier and stronger, but sometimes it goes awry, and we have to figure out how do we prevent it from going awry, but also how do we get back on track when things go south. I'm looking forward to having a conversation and listening and learning from the community tonight about your concerns, and it will help us in our thinking as we work this budget cycle and future budget cycles to build a system that is responsive to our urgent needs now, but also one that is responsive to our long-term needs. So thank you, Councilmember Albanese.
Thank you so much, Dr. Kroll. Jordan, I turn it back to you for the next segment.
Great. Thank you so much, Council President. Up next, we have Every Mind, officials from Every Mind with a special presentation.
Thank you, Jordan, and good evening. My name is Karishma Sheff, and I'm the Chief Program Officer at EveryMind. I'm going to spend just a few minutes this evening with you all to provide an overall picture of COVID's impact on our mental health and wellness. Next slide, please. So just to share with you very briefly a little bit about EveryMind. EveryMind strengthens communities and empowers individuals to reach optimal mental wellness. We've been serving the Montgomery County community for 65 years, and we provide programs and services serving the entire lifespan, from young children to older adults. In addition to our direct services, we also provide community education on a variety of mental health and wellness topics. Next slide, please. So what I'd like to start with in my presentation is to share with you some statistics on mental illness. And please note that the statistics on this slide that you see right now are based on pre-COVID data. So most of us know someone who has been diagnosed with a mental illness. And you'll see with the data on this slide that 1 in 5 US adults experience a mental illness each year. In addition, 1 in 6 US youth ages 6 to 17 experience a mental illness each year. And suicide is the second leading cause of death among people ages 10 to 34. Next slide, please. So now what I'd like to do is share a few points highlighting the overall impact that COVID has had on our mental health. We've seen a dramatic increase in food, housing, and income insecurity. And all of these insecurities have increased daily stress and anxiety for many, and especially those most disproportionately affected and struggling before COVID, including our minority communities. In addition, we all have, in some capacity, experienced an increase in feelings of depression, stress, anxiety, loneliness, grief, and loss. And grief has been so significant because it's grief due to not only from the death of COVID, but also due to prolonged isolation from loved ones and the loss of so many things that we've all experienced as council member Klass and others have shared this evening. Many of us are also experiencing difficulties managing our day-to-day with breaking news stories weekly, if not daily, leading to some of that exhaustion that Council President Albornoz mentioned. And CDC data from 2020 states that 40% of US adults are struggling with mental illness or substance use. Next slide, please. And furthermore, at EveryMind, we're seeing an increase in demand for our services since the onset of COVID. And we know our partners in the mental health space are too. Our hotline answered 32 more calls, texts, and chats than last year. Our hotline also conducted more than 10,000 suicide screenings, which is a 48% increase from last year. And more than 66% of our texts and chats and 10% of our calls to the hotline are from youth under the age of 24. So at EveryMind, we've seen and we know that our children and youth are experiencing an increase in stress and anxiety for so many different reasons, about being in school, being in densely populated indoor spaces and the fear of bringing COVID home, ever-changing social and global norms, the impact of social media, and so much more. And the older adults in our community continue to experience anxiety about COVID as well, and all of its many variants. And what we've also seen our older adults express is having a hard time returning to normal activities after such a long period of isolation. Furthermore, for our military and veteran community, we've seen requests for support not only increase, but become much more complex. And this is compounded by recent world events, such as the Russian invasion of Ukraine, resulting in higher anxiety levels for our military community. So I know that was a lot and in a short period of time. And that's really just some of the impact that we've seen COVID have on our mental health and wellness. But with that said, there is tremendous hope. And that's that COVID has helped us realize the importance of taking care of our own mental wellness. And it's really helping to reduce and break down the barriers towards accessing mental health treatment and the stigma associated with mental health. So as a result, many more of us understand that in order for us to be healthy overall, we must be physically and mentally healthy. And the more we open up and engage in conversations about our mental wellness, the stronger and healthier we become as a community. Next slide, please. So this concludes my presentation for the evening. Thank you so much for having me. I hope that it helped to paint a big picture of the impact of COVID on our mental health and wellness. And now I'm going to pass it back to Jordan to help lead us into the rest of this evening's program. Thank you so much.
Thank you so much for that helpful presentation there. Just so everybody knows, we received a lot of questions from residents on similar issues. So I'll be reading some questions from residents that reflect a broad part of the community. Now we'll move on to questions and comments from residents on mental health crisis services. Up first, we have a live question from Gail Spence. Gail?
Okay, so my question is related to the need for what can we do to create a roadmap for individuals and family and loved ones with information and guidance that can tell you where to get educated about an illness, how to get the insurance to cover the treatment, care, where to get treatment in relations to crises or, hospitalization or follow-up services and support. Because it seems like, a lot of the information and guidance is scattered across websites, organizations, and different public agencies. And so it creates an unnecessary burden on the individual as well as families in terms of putting together a plan to get the support that is needed. So how can one create one? And I think there's definitely a need for it, So what can be done?
Thank you, Gail. We actually have Dr. Crowell on the line for you, and he might provide some overview remarks about that.
Good evening, Gail. I think, and thank you for the question. There is so much to unpack in that question. The first order of business is that it seems that no matter how we try to convey information to people, that we never quite get it out there in the way that it needs to be gotten out there. So we have certainly over the years engaged counsel, engaged media, done our own outreach and education, and had a variety of providers who have helped to try to make sense of this mental health system. It's complicated. There are private insurers, there are public insurers, there's services to uninsured persons. And so oftentimes it just depends on what your circumstance is, what's available to you. But for the county, the very simple thing to do is certainly you can contact our access to services, access to behavioral health services in the county. And I can give you that number if it'll help. I'll put that in the chat, I think. Or actually, maybe I'll get Dornay to put it in the chat for me while we're talking about this, because I think that is a place where if you don't know where to go, that's not a bad first place to start. We're in the process of trying to build a navigation system for Health and Human Services because the whole department is incredibly complicated, and sometimes it's helpful to have a roadmap and a guide and someone who can talk you through the service pieces. 311 has been pretty good at that, but they oftentimes don't have the nuance about what your options might be. So hopefully we can build that out as we go forward in the future. But for now, I think access would be a good place to start for someone. It will take time and recovery as part of our recovery process for COVID, putting out information to people in ways that they can hear it across all the languages that people need to hear it in. So our team here tonight includes folks from the Crisis Center, folks from EveryMind, who can talk you through various pieces of the service now. But I think there is a need to do a better job of connecting people to the service. Was there a second part to this question, Jordan, if I'm not mistaken?
No, I think you pretty much covered it, Dr. Cole, but thank you so much. That was a great response, and thank you, Gail, for your question. Just want to give a friendly reminder to all panelists here in the Q&A section. Feel free to respond to the people that we have coming in with lots of questions here in the Q&A panelists. Please feel free to respond to that. Up next with a live question, we have Lisa Ellie. Lisa?
Hi, good evening. It's more of a comment and not a question, so thank you for taking this. So I want to say good evening and thank you for this opportunity to share my thoughts on how to improve the mental health for the county's residents. Before I begin, I want to first acknowledge the students of Montgomery County who are currently advocating for more mental health support and resources in their public schools. While these students are advocating for mental wellness options in the schools, I'm on the other side of the spectrum as an advocate for mental wellness in the workplace. 9 years ago, I was the target of a bully in the workplace. The bullying was so intense that I had to be placed on suicide watch inside a mental hospital. My firsthand account confirms the trauma that is affiliated with workplace bullying. I was the soccer mom type, a devoted PTA and marching band parent, a community advocate and volunteer, a recreational volleyball player, an active church member, and a former medic in the Army Reserve. I didn't have as much as a traffic ticket on my record. The morning I landed in a mental hospital wanting to kill myself is the moment my family and friends were stunned to learn that a bully on my job was the cause. As a result of my ordeal, I was considered disabled and could not work for several months. I was 47 years old with no history of mental illness. For the first time in my life, I had major depressive disorder, anxiety, suicidal ideation, and PTSD, all from a job. Now that I've recovered and have shared my story throughout the community, I now know that my story is not unique. Whether you're an adult or a youth, bullying can lead to depression, which can lead to suicide. We seldom hear about work-related depression and suicide. If you Google workplace bullying for yourselves, you'll see just how prevalent this is. I owe my survival to mental health care heroes, to the emergency room doctor, the nurse, the psychiatrist, the social worker, the therapist. They are the reason why I'm alive today and able to speak before you this evening for a cause that needs to be addressed. Abuse at work is the only form of abuse in America that is not yet taboo. Often the perpetrators are supervisors with impunity. 2021 statistics indicate 30% of adult Americans are bullied at work. And I just learned from Every Mind that 30% suicide rates are up in the Black community. Thank you for that statistic. Now, not only did I receive phenomenal mental health treatment in Montgomery County, but I had a strong support system from family and friends. And while I love to see laws protect workers and punish bullies, I'd like to see the county be a good source of support for recovering targets who face similar situations to mine. The one thing I wish I had access to back then was a support group for survivors of workplace bullying. There was a lot I had to navigate on my own, and I believe a support group would have provided crucial resources that I needed to heal and return to the workforce. I don't know how you would start a workplace bullying support group, but I'm willing to come to the table to continue this conversation and assist any way that I can. And as I bring this to a close, I will say within the past 4 days, 2 different people have reached out to me regarding bullying on their job. I'm not a mental health care professional. I'm not a legal expert. I'm just an advocate who is trying to prevent what happened to me from happening to others. And while I know the county does not have the power to go into these workplaces like the Avengers to make bullying stop, I ask that you join me in recognizing workplace bullying for what it is, traumatic and harmful to your mental well-being. I stand in the memory of targets of workplace bullying who took their lives with this brief moment of silence. Thank you for your time this evening.
Thank you for that impactful story, Lisa. Thank you for sharing that. Did we have anybody from Every Mind that would like to comment or give a response to the comment that we just heard? Not at the moment? Okay. All right, we'll go ahead and move on.
Helga has her hand up, Jordan.
Oh, she does? Okay, let me see there. Go ahead, Mom.
Thank you. So Lisa, your points are so well understood, and bullying at any age in any environment is something that shouldn't be tolerated. It's abusive and it creates unnecessary trauma And there are precautions and safeties in place for bullying and ways to report bullying in schools, but not so much in workplaces. Your other point about having peer support and support groups is really important. And one thing that I would encourage anyone that's in this meeting to consider is that there are many traumatic experiences. They may look different, they may have different results, but when trauma is the common denominator, there is an understanding and a bond among survivors that that's unspoken. I mean, it's something that people feel. If you can get people in the room that have had an adverse experience, and they bring that compassion and understanding and their own paths to healing together, I think that's a really important starting point to move forward and have some good supportive friends along the way.
Thank you for that remark. Stephanie, I see you have your hand up.
Yes, hi. I'm Stephanie Rosen with National Alliance on Mental Illness of Montgomery County. I put comments in the chat box, but just letting you know, we do have free support groups for individuals living with mental illness. We also have free support groups for caregivers of individuals living with mental illness. They are not specifically designed for workplace bullying. However, that is absolutely something that one of our support groups would be happy to address, and it's a safe, confidential space. I know a lot of times I've done some research on workplace bullying, and there is the potential for venting about workplace online coming back to actually hurt you at work. So you do want to make sure that you find an anonymous, like a confidential source for your support, and NAMI is here to do that for free. Thanks.
Thank you, Stephanie. And we see Johan with Every Mind there. Johan?
Good evening. First of all, I want to thank you for sharing your story. Bullying is, yes, another form of trauma, and it does have an impact on people no matter what the age. So through Every Mind and other organizations, I know that you can definitely reach in times of crisis, especially if you're feeling suicidal. So there are hotlines available that you can use. And definitely this is an aspect that affects people's mental health, and no one should remain silent.
Thank you for sharing that, Johan. Okay, up next, we have another question from a resident, but I'm going to go ahead and ask this on behalf of the resident. The resident asks if you can help clarify the emergency services available. They said they've been in a crisis with their son who has been violent for 2 years, and they've been met with a lot of dead ends. They said he needs residential mental health care, and they can't find any options with available space. I didn't know if Every Mind, somebody with Every Mind or Dornay Hill would like to comment on that.
Sure, I can comment. Dr. Kroll, did you want to comment?
I'll go right ahead and I'll join in. I was going to jump in there.
Thank you. So the emergency services in the county, there are many. It depends upon the age of the person. We have child services, we have adult services. Regardless, the crisis center is 24 hours a day, walk-in, phone calls, mobile crisis team. We never close. We're always available for consultation. And if there's ever a concern about what service or what avenue somebody should go to, I would recommend that they call our number. And I will put that as well in the question and answer. And we have also, additionally, we have the local behavioral health authority that oversees a lot of the programs in the community. And they are a great resource for cases and situations where people have run into a roadblock. And they also are able to help guide to different services that many of us may not know about in the community. As always, I'm available, and anyone else in any of the county programs are able to help guide and troubleshoot. And even if it's not our department or our wheelhouse, our motto is no wrong door. So regardless of what the need is, if they reach out, we will be grateful to help them and guide them. And if there is ever a violent situation, You can always call for mobile crisis outreach call. You can always reach out to fire rescue and the police department. And they also have the ability to partner with us and bring us in to help with the situation. Dr. Kroll?
Yeah, thank you, Dorney. I would say just wanted to underscore the mobile crisis response and say thank you to council for over the last couple of years expanding the capacity of the department to grow its mobile crisis response teams and to do more civilian-based response to crisis situations. But that is a resource I know that is likely someone in this room has access to, so to hopefully to good result. I am mindful that sometimes it's a recurring theme, and you can call us at any time in the crisis center at any time and over again, and they will continue to respond. I do know that one of the challenges we face in the county and in the country and in the state is the need availability for psychiatric beds for children and adolescents. At times, there is not a single bed available in the state, and so one of the things that we are constantly doing and talking to the state is about how to address that gap. We're talking with our area hospitals about it and with our state officials about how do we expand that. The other one is residential treatment, which is also an equally limited and expensive resource that the state authorizes for, that state manages. And sometimes there is an extensive delay in getting access to those beds. So certainly using the crisis center to help keep your child and your family stable and safe as an interim until those longer term issues can be addressed, and you can maybe find a residential program if that's what's needed for your child is an option. So that's the piece that I would add to this.
Thank you very much. Thank you both of you for that great response there. Up next, we have another question on behalf of a resident that I'm going to go ahead and read for them. This resident says they have 2 children and mental health difficulties run in their family. Their daughter is autistic, and her physician has recommended that she be assessed for autism as well. She says that her son suffers from ADD and depression. She's working for the county and very grateful for the great insurance, but regardless of insurance, Arlen covers a tiny portion of the bill, keeping mental health care out of reach for the majority of her family, including herself. Throughout the lifetime, this person says they witnessed many friends with mental health difficulties self-medicating because proper care is just financially out of reach. They feel strongly that if you make mental health care affordable, you will be diminishing addiction, as patients will have to take care rather than have to turn to self-medicate themselves in an attempt to deal with their problems. Thank you. So that's more of a comment, but I didn't know if somebody on the team would like to give a response to that comment.
So I think, I see Stephanie's hand up, but so I will yield to her for a moment, and I'll come back in if need be on this one.
Thank you, Dr. Kroll. Stephanie?
Sure. I just want to say one of the issues that you bring up is a parity issue. So how does insurance pay for somatic or bodily health issues versus mental health issues? There are federal laws requiring parity, but that doesn't mean that that's what we all experience. I know in Montgomery County, we have a lot of providers who are fantastic, but they do not accept insurance. And that's for a variety of reasons. It's not because providers don't want to provide help. It's something that NAMI very much works for at the state and at the federal level. Someone has brought up that tonight at 9 o'clock on the State of the Union, President Biden will be addressing mental health, and hopefully if there are stronger federal and state guidelines requiring parity, then that will mean that mental health care becomes more affordable for the many. In the meantime, please do apply for aid if for Medicare or Medicaid if you qualify. Everymind and Cornerstone are fantastic providers who accept those programs, as well as I said before, NAMI provides free support groups and classes. Thanks.
Thank you, Stephanie. Helga, I do see your hand up, and so there I see Dr. Chester, but Dr. Kroll, did you want to go ahead and give your comment before we?
I think very much to echo the things that Stephanie said tonight, that parity is an ongoing issue for us. The other piece of this is obviously reimbursement for our providers and by the private health insurance. We have a community where there are very wealthy people who can afford to pay whatever they want to pay for an hour of therapy, and insurance companies pay dramatically less than that. So the reimbursement rates are challenging. And because of the cost of an education, a lot of providers end up having to be pushed to hire into deeper in services and been doing private practice that pays more and not seeking reimbursement from the insurance companies. So the rates have to go up. Parity is certainly one of those tasks, one of those goals. We have in the county tried to figure out how to create low barrier access to services. So Montgomery Cares for folks who are uninsured is a resource that provides some level of mental health services. Our community providers provide some of that service as well. Medicaid and Medicare are options for people, but may not be depending on your level of income. It's one of those complications of our system.
Thank you for that, Dr. Kroll. Helga, I saw your hand up there.
Yeah, I just wanted to mention that one of the White House's priority issues is the 2008 Mental Health Parity and Addiction Equity Act, and to make sure that parity is upheld. So part of the fiscal year 2023 budget is proposing that all health plans cover behavioral health services with an adequate network of providers, including 3 behavioral health visits each year without cost sharing. So I think that's a big step in the right direction. I think we need to, hold providers accountable for treating mental health and behavioral health conditions at the same level as physical health conditions. And when we can get to that place, I think it will afford people in our community a lot more access.
Great, thank you. And last, I see Dr. Christina Chester had her hand up for a brief comment.
Well, no, thank you. And part of the question or the comment was around assessment services for students. And I just wanted to reiterate to our residents that MCPS does provide special education evaluation support for students who are in need of services within the school. This includes looking at providing mental health evaluations or assessments. Let's say if you need either a special education or like an IEP or a 504 plan for any student who may have a disability. And this includes doing special education evaluations for students who need services for autism. It also includes providing assessments for students who have ADHD or depression or anxiety or other types of mental health concerns. You can contact your school, the building administrator or your school psychologist assigned to the school can help you in terms of scheduling a meeting for you to discuss this. These assessments are provided free. And so this is a resource that is available for all families within Montgomery County. And so we just want to make sure that our families are aware of this. We don't want you to have to go out and to pay for an outside evaluation, which can go up to like $5,000 if you can get those services at school for free. So I wanted to relay that. And also, if you're in need of mental health services for your students, you can contact your school psychologist, your counselor, your building administrator, and they can work with you to see what types of services are available at the school for free, or what kind of services are available in terms of making referrals for any outside agencies that provide direct support to your community.
Thank you so much, you all, for all this helpful feedback. Up next with a live question, we have Janice Bloom. Janice?
Can you hear me?
Yes, we can hear you. How you doing?
Okay. My issue is about the availability of rehab centers, 24-hour in-house rehab centers in Montgomery County for people who were taking psychotic medications like Seroquel. And these people can have dementia, Alzheimer's, Parkinson's, or even things like schizophrenia and manic depression that are under control. And there is only one in this entire county where you can go. And that to me is totally alarming. If for one thing, it doesn't motivate that one particular facility to work as hard as they could. And for another things, if for any reason you don't like that one, you have no other place you can go. You have no choice. And so I would like to see that changed.
feedback. We have the Asian American Health Program on here to maybe address that briefly.
Could you be able to repeat the question? I'm sorry.
Ms. Bloom, can you go ahead and repeat that question?
Okay. My question, it's really a concern, is that if you are a person in Montgomery County that needs to go to a rehab, like if you break your hip and you also happen to have dementia, Alzheimer's, Parkinson's, or even some of the things like schizophrenia, and you're under control, you have only one rehab center in the whole county where you can go. There is no choice. And if you don't feel comfortable there, or you're out of luck, and I don't feel like they are very motivated to do their best because you have no choice. That is it. This one place.
Jordan, I think somebody from HHS may be in a better position to respond to this one.
I was gonna step into this a little bit and say that and I think we may have someone from our local behavioral health authority that can step in and have a conversation and talk about this a little bit. I think Viviana may be on cue to help respond to that. But I will say that the one of the challenges that we have is providers are free to decide what they want to bring up and what they want to stand up and serve. And right now, this is the service we have. However, I do want to say that if they are not providing quality care, that is a question for review and subject to review by the local behavioral health authority and by the state and by the state funders as well. So there is every expectation that even though there is no competition at this moment, that they are charged with the task of doing it right and doing it well, doing the best they can for folks who have both medical issues and psychiatric issues, and that is a challenging, or can be a challenging community to work with, depending on how well the medication is working and what else may be going on in their lives as they go through medical rehab recovery. But it is noteworthy that this is an ongoing challenge for the county.
Yeah, and I would just like to add that if you went on their webpage, their reviews were not very good. So being in a hospital and you looked at, they say this is where you have to go, and you look it up and you're horrified that this is your choice.
I was asked to answer your question. My name is Viviana Azar, and to me, the key aspect is that the fact that someone is taking a psychotropic medication shouldn't prevent them from getting good care at any rehab center. So I think as a county, we need to bring it up, and I'm glad you brought it up in this forum, so we can check with at the state level how that can be prevented in the future.
Thank you.
Thank you, Janice.
I mean, if there's anything I can do to help with this
Sure.
I'd be willing for you to contact me, and I would be willing to help.
Yeah, I received your email and it was brought up to the commission, so we're going to see how we can address it. But thank you for bringing it up, because this is a matter of stigmatization of mental illness.
The other thing that we have talked about over the years and worked with other alternative living facilities over the years is to encourage them to add capacity and strengthen their ability to work with individuals who may have a mental health issue and who may be on treatment. So that is the other avenue for us, because there are a lot of assisted living facilities and rehab facilities that are focused on health, on recovery for folks who do not have mental health issues, but that should not be mental health. Having a mental illness or being under treatment should not be a reason for them to avoid taking on the task of offering service.
Yeah, and I would just like to say they supposedly had an in-house psychiatrist, but I never saw that person. The person that treated my husband was a psychiatric nurse practitioner. And
so that is not uncommon. I'm sorry, I didn't mean to cut you off. Forgive me.
No, I mean, that was fine with me, but I thought she did a great job. However, the pretense is that you have to have an in-house psychiatrist, which if they had, I never saw that person. I don't think that person ever saw my husband.
So there are requirements for facilities like that to have a chief medical officer or a chief psychiatrist who would be who would be responsible for operating programs, but that doesn't necessarily mean that the person would be seen by that psychiatrist. It also doesn't mean that the quality of care is less for a psychiatric nurse practitioner. In fact, that is one of the things that is a challenge in the country, is that fewer physicians are entering psychiatry, and psychiatric nurse practitioners have come into their own as a resource for providing good quality service when there aren't as many psychiatrists available to provide psychiatric care.
Yes, I had no problem with the psychiatric nurse practitioner. I didn't think that was the issue. I think the issue to me was that they claimed you have to have a psychiatrist on board in order for to receive these people, and I never saw that person. I don't know who that person was.
Janice, thank you so much for your comments. We're definitely going to follow up with you offline. Thank you so much.
Okay, thank you.
Have a great evening. Okay, up next, I'm actually going to read this on behalf of a resident, and this question and comment is geared towards the Asian American Health Program, so my apologies for that. The comment in question is, given the stigma associated with mental health treatment across the AAPI community, in addition to the horrific anti-Asian bias and discrimination throughout the pandemic, you have been so successful in providing culturally appropriate supportive services across the entire community. Can you tell us more about this?
Thank you. Thank you for the question. At AHI, we always stress the importance of reaching the hard to reach pockets of community. And our work is never complete, especially when we're talking about mental health related topics in the AAPI community. So the perception of success, it's really sweet. Thank you. Thank you for that question. As most data reported on Asian Americans are aggregated, which often masks the differences and disparities that are experienced by the diverse group within the Asian American population, we're always looking at innovative ways to respond to the needs of the community. Some ways we respond to the community's need is by focusing on our core priority areas and continuously working towards building relationships and connections with these hard-to-reach community partners. So this could be in form of conducting outreach calls to Asian American-owned small businesses in the area, for example, empower community leaders through workshops and coordination of mental health first aid trainings, engaging the faith-based organization, and also providing cultural competency training to providers that serve the AAPI community. I would say developing culturally and linguistically responsive tools and models while ensuring we include the community voices in these conversations is one of the important components of our work. One of the examples of this would be our mental health proto novels, which is available in multiple Asian languages and discusses various practical and difficult mental health topics across ages. Finally, I think it's crucial to recognize that all communities have assets in forms of knowledge, skills, and resources. So with that as a base, we build on that framework to develop culturally and linguistically responsive mental health resources, supportive services, and also meaningful connections. So thank you.
Thank you so much for that helpful feedback. I'm going to ask another question on behalf of a resident. They said they personally become unavoidably aware of the impact of COVID in the past 2 years, and they know from talking with others that they're not alone, especially for so many who have mental illness, like in their family. They're asking if there's any free support groups led by someone who really understands these issues and can help offer real help. And we have Stephanie Rawson or somebody from NAMI available to comment or give feedback on that.
Yes, hi, Stephanie Rosen from NAMI. That's what we do. We provide peer-led, meaning individuals living with mental illness are trained and go through an extensive process to become volunteers who lead our support groups, who teach our classes. The curriculum is created at our national level. NAMI is a 3-tier organization, so there's national, state, and local. We also provide, like I said, free support groups. If you go to NAMIMC.org, that's NAMIMC.org, you can register for classes and support groups today. Thanks.
Great, thank you so much. Susan, I see you have your hand up as well.
Yeah, so something, Stephanie, I don't think you mentioned, but it's also important. In addition to people with lived experience, if you're a family member and you have a loved one and you just, what am I doing wrong, or how do I deal with this? You have a class and the teachers are other family members who've been through the same process. So it's a very powerful opportunity to really get a better understanding and not feel alone.
Great. Thank you so much. Thank you so much, everybody. Right now, we're going to go ahead and move on to questions and comments from residents on youth mental health services and things like that. Up first, within this portion, I'm going to ask a question on behalf of a resident. They're asking, how can we promote healthy racial and cultural identity development as a fundamental element of overall mental health? And how can they ensure funding for, how can they ensure funding goes to culturally agencies that can promote Black identity development in young children? So I don't know if we have Arlie Wallace here, Ms. Wallace, that can answer that or comment on that, please.
Ms. Wallace, you're on mute.
Just give her a moment to unmute herself. There you are.
Okay. What I would say, a way in which we could actually do to address and to promote that is that we have to really take a look at some of the current programs that we have that could actually be refined. We can at least look at policies and some of the practices that we have so that we could promote stronger racial and cultural identities to really be there to improve the overall health support. One of the things that we have been fortunate to do or unfortunate to do prior to COVID-19 was to actually look at the need of bringing in social worker to our particular program within the African American Health Program, because we could see the distress which was being identified from chronic disease that was persistent in the Black families. One of the other things we could do overall when looking at making some adoptions is we have to look within the community and train some of our community persons to be almost lay persons that they can go to and bring in and be able to speak and identify, because they are critical, because they speak and live, they know the individuals trust them, and they can really represent them to build the trust coming from the government agency, which people are extremely reluctant to go to without having someone whom they can trust. And we also have to deal with the other issue is the navigation that people have already mentioned earlier tonight. It can be a challenge. And when people are under any form of traumatic or stress, it is difficult for them to even find their way to get to the door. And once they get to the door, they really need to have trusting, understanding people who can communicate with them and understand them, and to then try to bring them through, to go through the process of healing in the most quickest possible way to address those issues of mental health challenges that we're facing.
So I have two comments about that I would add. One of them is that there is workforce development, there's workforce diversity issues in this process. We have to be about the business of figuring out how do we diversify the workforce, the mental health workforce across the county, and not just in county, but in our provider community, so that no matter what door you go to for a mental health professional, you find someone who is from your community, who understands your culture, who is trained and sensitive to the culture, that you can trust and listen to. I think that is one of the things that we're working on, and something that the Councilmember Navarro and I have discussed off and on over the years, is working on that workforce diversity pipeline in behavioral health for the department, but our conversation is now expanded to include other resources as well and other partners as well. The other thing is that there have to be providers of color in the community. There have to be folks who are indigenous to the community who provide the services that are running the business that are providing that service. And that's a piece that I think that COVID has revealed once again for us that is a deficit in the community, and especially in the Black community at this moment. There are providers out there, but they are not necessarily supported in the way that we need to support them going forward, I think. And then the last one is that because this is an urgent situation because of COVID, we do have to do what Ms. Wallace has suggested, and that is to identify community members and community partners who are like dads on duty with some mental health training, or neighborhood liaisons from one of my previous programs, where there are folks who are in the community that are trained to help support members of their community and to help them take those steps to get from their community to a mental health provider when the time comes.
Councilmember Navarro. Thank you,
Thank
Dr.
you. Yeah. Yes, Ms. Wallace, first of all, thank you for everything that you have done, because what you just described is so critical, and I think it really should be at the root of a lot of our conversation. We learned that, of course, through the response to the pandemic. So when we stepped forward in a collaborative fashion and we created the Latino-centric COVID-19 initiative and the African-American-centric COVID-19 initiative, it was precisely that. It just incorporated all of these elements that were culturally proficient as well as linguistically proficient. And it's no surprise that we were able to close the vaccination rates in the Latino community and the Black community. And so that template is one that we absolutely need to continue to utilize because we know it works. We need to do the same in the mental health space. And I'm glad that you mentioned this notion of, yes, it's very difficult to find those licensed social workers. We know that there's a lot of, issues with that in terms of shortages, but we can definitely train people that are loved in the community, that are willing to step up, that folks can trust, because we have no choice but to be innovative and be creative in the face of this newfound situation. And so to me, the good news is that we know what has worked. We've seen it through these initiatives that were targeted. So now it's how do we then make that a permanent fixture of our service delivery model? And how do we scale it up? Because another thing that I'm reminded of, and I was reminded of that this afternoon in another conversation, sometimes we talk about our communities of color in the county as if they were just small pockets. But we know what the census just showed, right? It showed that we are a county that is reflective of this country. I mean, we're a majority people of color, our Latino community, our Asian community, our Black community. Put it all together, we're the majority. And so therefore our service delivery models, you just said something, maybe we need to look at programs and we need to realign those, redesign those to respond to the needs of the population of 2022. And that is the type of work that I have to say we have begun. Dr. Kroll has been an extraordinary partner in that. But now as we receive the budget request from the executive, we're going to be looking at that very carefully to see where are those opportunities to truly accelerate and build upon what we have done. But it has to be bold, because we are in that kind of moment. The crisis is real. And many of us who are here today have the privilege of being able to talk about this during this virtual conversation. But we know there are many, many, many residents who are suffering right now that are not even able to come and share with us. So we have to be bold and we have to respond. But I really appreciate you bringing that up, because to me, that is at the root of a lot of what we've been talking about here tonight. And the good news, again, is that this county does have the assets, so we can leverage that and we can move forward with something extraordinary.
Thank you, Councilmember Navarro. Just before we move forward, we're going to get some intro remarks from Councilmember Jawando, Councilmember Rice first, then Councilmember Jawando, and then Councilmember Friedson. Councilmember Rice?
Well, thank you very much. No, I appreciate it. I just wanted to touch base because on the standpoint of when we talk about what it is that we need to do with our schools, it's very clear. And I think it was alluded to via NAMI before when we heard about what the president's plan is going to be tonight. I've actually been a little bit briefed in terms of what the president's going to be announcing and don't want to steal his thunder. But help is on the way. And it really is aligned with what we've seen and we know that we need to do as a county, but what we need to do as a nation in addressing many of these issues. When it comes to ensuring that our students feel safe, feel supported, feel as though the only thing that they need to focus on when they walk into our schools is that they have the support necessary to focus on their schoolwork and to achieve, then we have great outcomes as a result. And so from that perspective, I think that the great things that we're doing that you heard from some of my colleagues, whether it's increasing mental health supports, whether it's increasing some of the guidance counselors that are in our schools, whether it's increasing dads on duty. And now we have a proposal that's asked to bring dads on duty to every single high school in the county. So those mentorship programs, all these are great opportunities for us to counteract many of the social challenges that we see in our community as a whole. And so from that standpoint, I think what we need to do is double down on these efforts, these great efforts that we've done via COVID in our response to the COVID pandemic and what we've seen, and make sure that we can continue to build and expand those, because we know that that is going to be needed in the future. If we are truly talking about a recovery of our children, it has got to be in ensuring that they have the supports to deal with a lot of the trauma that they've been dealt in these past few years. And I'll just close by saying this: keep in mind, in our Black and Brown communities, those are the ones that were hit the hardest when it came to the COVID pandemic. Those are the ones that saw the most deaths. Those are the ones that saw the most losses when it came to individuals losing their jobs, had the most economic opportunities that were interrupted. All of that, our Black and Brown children saw. And so it's really important for us to make sure that we're doing everything we can to support them, to get them back on track so that they can, again, just focus on their learning. And so from that perspective, I just want to assure folks that we will be working hand in hand with our state and federal partners to make sure that those resources that are coming are correctly spent in a way that we know is going to benefit those students that need it the most.
Thank you, Councilmember Rice. Councilmember Jawando?
Thank you. Appreciate everyone's comments. This is such a needed conversation, and you can't have it enough because we've, as was mentioned at the beginning, we have a history in this country, unfortunately, of not talking about these issues, and now we are in a crisis and have to talk about them. So we had started that work before, but this is going to, I think, focus us in a necessary way. And so it's great to see all the resource providers here. You know, we are, in relates to our youth. I'm Councilmember Jawando. I'm an at-large member of the council. I'm on the Education and Culture Committee and on the Planning, Housing, Economic Development Committee. I have 4 children, ages 11 to 3. And all of whom have dealt with some level of trauma over these last 2 years. I shared at a previous council meeting that you know, we saw our daughter searching on her phone, our 11-year-old. You know, how do I know if I'm depressed, and what do you know? And when you find something like that, that's just one of many, many stories, tens of thousands of stories around the county that kids are trying to deal with this. And it has to be a holistic approach. And I so appreciate that I got to go right after my 2 colleagues on the Education and Culture Committee, because we've been laser focused on this and had several sessions. Everyone that encounters our young people, from the bus driver in the morning to the aide at school, to the lunch person, to the janitorial staff, to the educators and counselors, to the coach after school, to the if they take ride on, the people at home, you know, we have to have an entire community approach. There has to be a mentorship program after school. We have to have wellness centers. There's so much to do in the lives of our children. Then our parents, who are also been stressed and dealing with so much, have to have the support so they can support their children, or their caregivers, in case if it's not a parent situation. And so it's really a holistic approach, and realizing there's a range of needs, right? You know, and I think the Be Well 365 that MCPS had started pre-pandemic is a good example that some children just need someone who's going to say hello to them and smile at them in the morning and notice something and get them referred to the right services. And it's not all crisis level. And we want to get and intervene where all of our kids are meet them at the point of their need. And that's the system we're trying to build in partnership with our nonprofit community and with Dr. Kroll and with MCPS. And we are ready at the council and have demonstrated this, that we want to fund and scale it to the extent to what's needed. And so appreciate the conversation, and just know that we're here for you. And this is really helpful to hear all these stories. Thank you very much.
Thank you, Councilmember Jawando. Up next is Councilmember Friedson.
Good evening. Thanks so much for everybody being here, for all the work that everyone's doing, for the courage that it has taken to ask some of the questions and to lift up some of the stories that have been shared tonight. It really is eye-opening. It's so important. I am pleased to join colleagues here. We've been working on these issues for quite some time. In fact, Councilmember Jawando and I, in our first budget, really tried to lift up issues related to our crisis hotline, making sure that we extended those hours. We built on that during the pandemic. We've worked together with all of our colleagues in just about every way we could, and yet we are still not coming close to meeting the needs that we know are out there. And I know we'll continue to do that work. And I'm reminded tonight, we talk a lot during this pandemic about, we're flying a plane as we build it. This is new for us. And thinking a lot about that airplane, when you're on a plane and you're in the beginning of the flight, you're always reminded when you're losing cabin pressure to make sure you put your oxygen mask on first before you help anybody else. And that's true of mental health too. And tonight, if we take away anything, it's the importance of self-care, of taking care of not just each other, but taking care of ourselves, because we can't take care of anyone else if we're not taking care of ourselves. And I don't think we note that enough. That's true with external and internal pressures, just like cabin pressures on an airplane. During the pandemic, we also talk a lot about how it has brought to light those who are living paycheck to paycheck, who are living in a very challenging environment, and the pressure that this has put on, who are just one missed paycheck away. Similarly, in mental health, it's one incident away from a mental health crisis in a very similar dynamic. And it has come to light how many people in our community, in our family, at our workplace are just one incident away, one pressure away, one challenge away from being in crisis, an absolute and total crisis. And we have not provided the level of supports across the board that we all need. We haven't treated this issue with the sensitivity and the seriousness that it requires. And I think that's changing. And that's one of the lights in this dark time, and appreciate the ability to be able to work with everybody on this call, and to be able to be a community that really lifts these issues up, and a county that works on them as well. So I'm Andrew Friedson. I'm the District 1 County Council member, and really pleased to be able to join this evening, and glad that we're having this critical conversation.
Thank you, Councilmember Friedson. Just a friendly reminder to everybody, we will hear from other council members in a little bit, but we're going to go ahead and move on to the next question for now. Up next, we have a live question from Carla McEachern. Carla? And just in case it doesn't work, I'll read your question for you, but I'll give you a few moments to come forth.
Hi, are you all seeing me?
We don't see you, but we hear you, Carla. Our IT team is working on seeing you, but you can go ahead and give your remarks.
Okay, thank you very much. I had to pull over, I'm driving. So my question is, so first of all, I am a Montgomery County public school teacher. I have been for 32 years, taught at various grade levels, but my question is for, I'm the mother speaking today. So how are MCPS students and families being supported regarding matters of gender and racialized trauma in the classroom when the perpetrator is the coach, the teacher, the counselor, or other staff member?
Thank you for sharing that, Carla. We have somebody from MCPS on here at the moment to give remarks about that.
Okay.
Yes, and good evening, and thank you for the discussion, as well as to the council for having us here this evening. I will start off, and then I'll turn to my colleagues to share as well. And I'll start off by saying that number one, that equity is a core value of our system. I just want to put that out there from the beginning. And when we talk about equity, it is about providing our students with what they need, when they need it, in the manner in which they need it. So essentially, we are meeting our students where they are. All of that to say that if you have been following, this question really speaks to, I heard the racial and the gender portion as well of your question, really speaks to our anti-racist audit. If you are not familiar, I would encourage you to jump on to our website. We're actually currently administering surveys for many of you who are MCPS parents on the line or in this virtual space that will be surveying our families as well as our students and our staff for that anti-racist audit. But that really helps to guide, as I mentioned, our equity core value, the work that we do in ensuring that all of our students receive what they need, again, when they need it. And we're specifically looking at our practices of evaluating, for example, evaluating our school cultures, as well as I heard was mentioned in the conversation earlier, looking at our workforce diversity initiatives. Are we having mental health professionals, for example, that match the needs of our individuals, of our students? So just a couple of examples to share with you of how we are doing that. Number one, I wanted to share I'm working with our student family support and engagement team that we are engaging in professional development, professional learning, specifically around anti-bias and anti-racist work, ABAR as we call it. So I think that's important to call that out, specifically around culturally responsive relationship building. When I mentioned meeting our students where they are, just one example of that. Also, I would highlight the psychoeducational lessons that we have been doing with our students, specifically around systematic racism. That's important to note that that is ongoing work that we're doing. There are waymaking videos, which I know Dr. Chester is on the line. She's been the host of that. Again, I would encourage you to jump on our website if you have not done so, which speak to our work around anti-racism, and they are in English and also in Spanish, and she can speak to that a little bit more. But that's an important resource that we have as well. And so I'll close, and before I turn it over to my colleagues, just close by saying I know I heard earlier when Councilmember Jawanda spoke about being a parent in MCPS, which I am as well. I like to call myself a scholar, a practitioner of the work that we do, and just thinking about being a parent of 3 Black boys, 14, 11, and also 7, and just thinking about especially my oldest, who did have difficulties navigating this health crisis. And so making sure that we are, again, meeting our students where they are and providing them the appropriate resources to continue to navigate this crisis is critical. And I just want to thank, before I do turn it over to our board and also to our county council for providing the resources that are needed, and also acknowledging that this is a mental health crisis that we are navigating. So again, I can turn it over to, or I'll cede back to Jordan.
That's fine. Thank you so much, Mr. Davis. We will actually have that offline. Ms. Carla, if we can provide more resources to her, that would be great. But thank you so much for that input. And Carla, thank you so much for your question.
May I add a little more, please?
Sure.
So the answers that were, that you just shared match what I did research on the MCPS website. Remember, I said that I am an MCPS employee. So when I went to see what kind of recourse I could take against the adults who, in my presence, said certain things to my daughter, I really would like to speak to someone offline because there's quite a bit of a story here. And all the information I saw was addressed as though the student had the problem, as though the families have the problem. I did not see where I could go and communicate with the adult. So here I am, an MCPS employee for many years. I know the language, and other parents don't know the language. They don't know the curriculum. They don't know what's supposed, some may not know, let me put it that way. So my daughter and I were traumatized, and I did not know where to go to get myself help or to get her help. Yes, I could call Kaiser, but it's a different situation. It's a Montgomery County public school thing, or situation rather. This issue that I'm halfway talking about here is somewhat similar to a previous person talking about on the job bullying. So I'm saying my daughter has been bullied by adults, on top of mistreated in areas of, you say the counselor. The counselor said did something I found out in terms of not allowing her certain courses. There's so much to this. So I'm here to get help. I hear all of this stuff again for the parents, for the students. It seems as though we are being blamed when in some cases the adults whom we send to sit in front of our children are causing them the issues. That's what I'm talking about. So yes, I am aware. Okay.
No, go ahead, Ms. Carla. I'll let you finish your
So
statement.
yes, I am aware of the anti-bias audits. That's not helping me right now. That's not helping that adult who said certain things to my daughter in my presence, in the presence of the administrator. So I know that that particular, there were several incidents actually, but those cases are not indicative to just the one school. So again, I know you guys don't know the answer right now, but please don't keep putting it out as though it's the students, the parents. What are our staff members doing? How are they being treated? Not treated, how are they being trained? Truly trained.
Yes,
Okay, I
Ms.
can
Carla,
stop.
thank you so much for your input. And Mr. Davis, you've heard everything that she said. Thank you so much for sharing your story here. We will have to take that offline due to the nature
All
of
right.
it.
I was just going to say,
But he will definitely reach out to you, Carla. That's what we're here for tonight. So thank you again for sharing.
Thank you.
Of
All
course,
right, thank you.
Ms. Davis, we will share the information.
I'm happy.
Jordan,
Thank
Jordan,
you.
can you just have, I think Diego and someone else, this is an important topic of like what the kids are dealing with, particularly our kids of color. I want to hear from some of the community. I think that it warrants a response from some of the.
Mr. Diego, I see you have your hand up as well.
Thank you very much. Carla, I would encourage you to call me at the Black and Brown Coalition. You can call me on my cell phone. I say it publicly. Hopefully only you hear it. 301-518.
One second. Hold on a second. Let me get something. I started driving again. Excuse me. Let me pull over. Thank you very much for reaching out. Okay, I'm ready to write.
Carla, my name is Diego. I'm one of the co-founders of the Black and Brown Coalition. And we'll be happy to talk to you about what happened to you and your daughter. My cell number is 301-518-8705. Okay? 301-518-8705. So,
thank you.
Thank you. So one of the things that the first thing that you do with someone when they went to trauma is to validate their experience. That's the number one thing. If you ignore them, then we re-traumatize them. And I have to tell you that when something happens to us and we are suffering, it's very painful.
Yes.
When the suffering is from a loved one is even more painful. And when that loved one is a child, it's unbearable. And when parents are there trying to find solutions for the pain that their children are suffering and they don't find them, it's extremely, extremely challenging. So when MCPS, and I don't blame Everett or Dr. Chester, okay? But when MCPS says that it's easy to just call the counselor, just call the principal, when we have today people calling us saying that it has been impossible to reach a counselor, hundreds of parents have told us, Black and Brown parents, they cannot reach them. So let's not pretend, we have to validate them. MCPS has to validate and say, we have a problem, we cannot deal with this, okay? Because when you say, just call the counselor, call the principal, call someone else, you are telling people that they are the problem, like this mother and child. So and there's someone going to testify soon about that too, but the council will approve the budget of MCPS. MCPS is not a culturally competent system. It is not an equitable system. It is not an anti-racist system. It is not. Nope. So it has lots of resources. Everything that Dr. Chester mentioned is true. They have tons of resources, but very few people access them. And the ones who access them tend to be white, tend to be highly educated, and tend to have resources. So, and Black, brown, and poor tend not to access. We have parents years trying to get a diagnosis of a child with a learning disability, years. So don't tell us that you call the counselor at the school, you call the principal. That is not the reality that poor Black and brown families face. So I think it cannot be changed overnight. Advocacy is very much needed, and Carla, please do call me and we'll work with you. But the council also needs to, when you approve the budget for MCPS, we have to demand what they're going to do with the almost $3 billion if they offer services that are not reaching the majority, as Council Member Navarro mentioned. Then why are we funding it? Anyways, I don't know what I'm going around, but we have to, first thing is to validate people's experiences. And I felt that tonight we're not doing that very well, particularly as it relates to MCPS. Thank you.
Thank you so
Thank
much
you.
for your input. Thank you, Carla, for your input. And again, we will follow up online. It seems like a very, very important topic that you raised. So thank you for that feedback.
Thank you.
Jordan, I would be remiss if I didn't just react to something you said, Diego, which is that I don't think it's just low income Black and brown parents. So I think we need to qualify that because that's stayed with me. It's the reason why I ran for office, because I had the same experiences with my own daughters at MCPS years ago. So I wanted to qualify that because I think that, there are a lot of middle class or upper class Black and brown parents who also can't find a way to navigate and to be seen in a system that is, I think, 72% children of color.
100%, Nancy, 100%. It's even worse for those who are not as educated as others. Anyway, so 100% in agreement.
Thank you. Thank you, everybody, for this feedback. Up next, we have a live question from Dara Feldman. Dara, this will also be directed at MCPS representatives.
Thank you, Jordan. Thank you, everybody. So grateful for the commitment of everyone focusing on mental health. And before I ask my question, I just want to acknowledge the pain. And as an educator, I've been an educator for 38 years. I grew up in Montgomery County Public Schools. I raised my kids, and then I taught for many years in MCPS. And I just, as a educator of unearned privilege, as a woman of European descent, I just really want to extend my heartfelt apology for harm that I know that I unintentionally caused over my years of teaching because of what I didn't know, what I wasn't taught, and the lies that I perpetuated. And I am absolutely committed as an ally to uplift the truth and to be of service in the healing, also as a restorative practitioner. So truly, truly, so much love to you all. And my question is, I work with educators around the world, and we are really suffering from compassion fatigue, burnout, and moral injury. And when I say educators, I mean everybody from superintendents to people who drive the bus, anyone who's working with children. And so I'm wondering, with this focus on how we're supporting children and youth, how the county can really create a holistic approach that is healing-centered, restorative, as well as trauma and culturally responsive to the first healing and well-being of educators, because we meet our students and are responsible for their lives and impact the families, as we just heard from Carla as well, on a regular basis. And for those of you who don't know, more than 80,000 educators resigned last November and December in this country. MCPS, we've got this. We know we have so many resources, so many committed people. So how can we break apart these silos and really work in unity to help with the healing that's holistic for our educators so that we can then truly be of service to our students and our adults and their families? That's my question.
Thank you for that question. MCPS representative we have here can briefly respond to that, Mr. Davis. Thank you.
Sure. Yeah, I'll start off. Thank you for the question. And I would start off by saying, I think it goes back to, I heard it mentioned earlier, and I know Dr. Chester always says this, so we must put on, I think it was Councilmember Friedson who said, put on our oxygen mask first. Extremely important that we keep that in mind as we continue to be the caretakers, especially I know within our team, the caretakers of those who need the most care at this point. But we cannot forget, and I see that she just posted in the chat as well, our Be Well 365 initiative that I know was mentioned earlier. For those who are not familiar with that, that is our initiative for our physical, social, and psychological well-being of all of our students, all of our schools, and particularly all of our staff, which is what I heard of the question being asked. What are we doing to support them? And so I would bring forward, especially around that compassion fatigue, a couple of examples of how we are supporting our staff. I know that holistically, I heard that mentioned also, and I can speak specifically also for the SFSE staff, our team. We work very closely with the Employee Assistance Program, also known as EAP, and they actually, just a couple of weeks ago, as a matter of fact, came and joined us with some professional learning around exactly that, compassion fatigue. What is it? What type of resources are provided system-wide? And I know that they continue to work through our colleagues' offices to provide those resources. So one example of what is provided. I would also bring forward, in addition to that, that we work very closely with our Employee and Retiree Services Center, also known as ERSCI, and they have what's called a Well Aware, and I think I see Dr. Chester's dropping links in the chat, but they have what's called a Well Aware program, which again focuses on the physical, the social, the psychological wellness of our employees through, for example, having exercises, physical exercises, having mindfulness activities, having regular reminders, daily reminders of what needs to happen in order to maintain that mindfulness as we go throughout the day. So they are another resource for us as well. And the last piece I was sharing, and I can turn it over to my colleagues also to chime in, we mentioned having resources to meet the crisis, again, the mental health crisis we continue to speak about, and of course are continuing to problem solve. One of those opportunities, as I would call it, that we have embraced is having mindfulness rooms. I know some of you might be aware that we have them in many of our schools right now, but our goal is to operationalize, to bring it to scale, to have a mindfulness, a wellness space in every single one of our schools. And so when I talk about that, of course, thinking number one, it's for our students. The priority is for our students. As I mentioned with the Be Well 365 initiative, it is for all of our students, all of our schools, and also for all of our staff. So we would like to have that resource, and that was an amendment that was included in the budget. Again, thank you to our Board of Education for their support with that, and is moving forward to our County Council, again, looking for resources that we can use to address and support and navigate the current crisis.
Thank you, Mr. Davis. And I do see Dr. Chester and Ms. Susan up, but if you guys can just provide your answers there in the chat due to time constraint, I'm so sorry, we do have to move on to the next question here. But if you guys can, again, provide those resources in the chat, everybody, what he just addressed will be in the chat. More resources are there for you guys to check that out in the chat. Thank you so much, Mr. Davis. Up next, we will just give some brief remarks from Councilmember Katz, Councilmember Hucker, and Councilmember Reamer. We're going to have some brief remarks from them, starting with Councilmember Katz.
Thank you very much, Jordan. And I heard you use the word brief, and I will try my best to do that. First off, thank you, Council President, for having this town hall. It is so very necessary. And just last week, and I know we're going to hear from him in a few moments, but Councilmember Hucker had a student listening session on mental health issues as well. And, you know, we learned so very, very much. And I want to begin by thanking everyone for sharing their stories and for giving the answers and for doing the work, trying to help each other. My colleagues have heard me say many, many times that I believe a community is a family, and our family is in a crisis. We have a mental health crisis, but it's our family members that are in it. And so we need to continue to work together. Some things might not work, and some things might have to be done a couple times in order to figure out how to do it right. But we need to continue to have these discussions. Some of them are extremely difficult to hear. I mean, but we still have to hear them. And if we don't hear them, it's even worse, because we can't correct what has happened unless we know what has happened. So I promise to be brief, and I will be, but thank you very, very much for everyone for being here. And thank you to the caregivers for doing all that you're doing. Thank you. I'll turn it back to you, Jordan.
Thank you so much, Councilmember Katz. Up next, we have Councilmember Hucker.
Thanks, Jordan. Good evening, everyone. I'm Tom Hucker. I'm the chair of our Transportation and Environment Committee and serve with Councilmember Katz on the Public Safety Committee as well, where we get into an awful lot of these issues. And I'm also a parent of two young boys in our public schools as well. So thanks to President Albornoz for holding this town hall, and really to all of our experts that are here tonight and the community members for sharing your stories, many of you very bravely. There's definitely no more important topic that we could be talking about right now. And Dr. Kroll is right. We had a widely acknowledged mental health crisis before COVID. And I think everybody here knows that, but it's much more severe now. Councilmember Katz mentioned the youth listening session that my office put together last week just on student mental health. We also held a town hall on schools last month, and 5,500 people turned out. And the number one issue people wanted to talk about, whether it was students or educators or parents, were mental health issues for 2 hours. We heard raw and heartbreaking stories from so many people that really aren't getting the services that they need. And I totally agree with so much of what Diego said about the gaps we have in MCPS and in the county services, I believe, as well. You don't have to, I think, believe me or Diego or anyone else. Hundreds of our students will tell you the same thing. And we have a lot of their feedback videotaped. But the good news is that in so many areas, our students often have great answers and very clear suggestions for what they believe would help their friends who are suffering, that they see every day. And our educators and parents have great suggestions as well. We have a lot of work to do. We're going to receive a budget from the county executive very soon. We need to all meet the moment and make mental health a true priority this year. And that will mean additional staff. It'll mean additional contract services. It also means making sure everybody has equitable access to the support that they need. And just last, I firmly believe we can't let the perfect be the enemy of the good. This is Montgomery County. We love blue ribbon commissions and long meetings, and we have both an immediate problem and a long-term problem, and we have to address both of them. We need comprehensive mental health support long-term, but we also need appropriate immediate crisis services right now because too many, especially of our young people, are suffering. So I'm really thankful. Again, we're having this discussion tonight, benefiting from all your expertise and looking forward to working with my colleagues to do our best addressing it. Thank you.
Thank you, Councilmember Hooker. Up next, we have Councilmember Reamer.
Thank you. Really glad to be here and to hear from so many community members and community leaders. This is just such a vital topic. The impact of COVID on mental health has just been devastating in so many different ways. And I feel like we really need to take an inventory of these impacts and try to help understand how to prioritize our resources. I mean, we've got a rise of teen or youth suicide. We've got really, really problematic mental health crisis with many students who have been isolated and, just have not thrived through the last couple of years. But the same goes for seniors. Seniors are, isolation is the number one most dangerous condition for older adults. And many have been in enforced isolation, due to public health measures for a very long time. And I'm terrified of the decline that I know many will be experiencing. And we need to figure out if there are ways to reverse or at least, get back to the programming. I mean, the fact that libraries were closed for so long, that's like a real mental health impact on people who need to be able to get out and socialize. I've talked to so many working parents who are feeling incredible stress, not having access to childcare services. Fortunately, I think that has started to ease, but not being confident in their position in the workplace, their career. That's big impact. And of course, we're seeing a rise of gun violence and hate. There's been tremendous expressions of hate in our community, targeting a variety of groups. So the toll on mental health, I think we will come to see as a devastating one. And we need to better understand it, and we need to prioritize our investments. And there's so many different dimensions to it that it's really tough. But, we can tackle that with effective interventions in the schools and ensuring that those resources are available, and through our libraries and through our senior centers and through our HHS programs. We've got a lot of work to do. So I appreciate all the input and the feedback here today. And I look forward to working with my colleagues in this budget to make sure that, we get it right and we put our resources to their highest and best use. with this crisis. Thank you.
Thank you, Councilmember Reamer. Up next, we have a comment and question in Spanish from Ms. Olympia Alvarez. We're going to have Marcela Rodriguez help us with interpretation services. Marcela and Olympia.
Olimpia.
Sí, hola, buenas noches.
Puede dar su testimonio, Olimpia. Buenas noches.
Ok. Agradezco la oportunidad que me brindan para poder expresar mi opinión. Quizás la información que ustedes tienen sea muy buena y los recursos también, pero el problema más grande es cómo hacer llegar esa información a los demás. Sé que al necesitar ayuda hay que contactar al consejero de la escuela, pero establecer ese contacto con la pandemia ha sido difícil, imposible diría yo. Y es más ahora en la academia virtual, yo desconozco qué hay que hacer. La salud pública es un reto para los gobernantes, pero para los padres de familia también lo es. Tengo un niño de 9 años. Es un estudiante sobresaliente con notas de A en todas las materias, catalogado por el MCPS como GT. Y aquí les muestro la carta. Pero la pandemia me le afectó y bastante. He buscado ayuda desde el 2020, pero nadie me ha brindado ese apoyo de verdad. Quisiera más orientación sobre qué hacer. Una comunicación más directa e instituciones que difundan el servicio de una forma clara y sencilla, sin tanta burocracia. Muchas gracias por dejarme expresar mi opinión.
Good evening. I appreciate the opportunity you all have given me to express my opinion. I believe the information you have is very good and the resources are great as well. But the biggest problem is to get that information to others. When you seek help as parents, you need to contact the school counselor, but establishing that connection has been even more difficult in times of a pandemic. And I would say it has been impossible. And with virtual learning, I just don't know what to do. Public health is a challenge for governments and parents as well. I have a 9-year-old boy, and he is an outstanding student with A's in his classes, and who is part of MCPS GT list, which stands for gifted and talented. Unfortunately, the pandemic has affected him so much, and no one has given me support or guidance to help my son. I would like professional guidance on what to do, more direct communication, and institutions that provide their services clearly and simply without so much bureaucracy. Thank you for your time and for the opportunity to express my concerns.
Thank you, Olympia. Thank you so much, Marcela, as well. And I think we do have an MCPS representative on the line to respond to that briefly.
Yes, we do. And I'm actually going to pivot too, so I'm not hogging all of the airtime here. I'm going to pivot to Ms. Cow, who is on the line also, who represents our Student Wellbeing and Achievement Team, which is our school counselors.
Yes, thank you so much for sharing. And I do want to echo what another family indicated as well, that expressing that the school counselors have been hard to connect with recently. I would love to talk more with you about this offline with our specialist as well, who is working with all of our school counselors, just to really hear what is going on with you and within that student and the experience that you're having directly. Because you're right, this should not be a challenging time, and being able to work with your child's counselor and navigate the school is something that needs to be a much easier process. It's also important that we take advantage of the partnerships that we have with all of our agencies that are on this call that we can work with as well to be able to support your child. But that really does need to come, school and community together. So I will be reaching out to you to continue.
Thank you so much. Marcela, I didn't know if you want to also comment and translate that in Spanish as well for us, please.
Yes, Jordan. Señora Olimpia, lo que los representantes del Distrito Escolar de MCPS quieren decirle es que le agradecen que comparta su testimonio y su experiencia, y que están de acuerdo de que en estos momentos tan difíciles es cuando más necesita este apoyo. Entonces, ellas, por parte de MCPS y también las agencias que están participando en esta conversación, se van a comunicar con usted fuera de esta reunión, de esta asamblea, para ver de qué maneras pueden darle apoyo para sus hijos en estos momentos tan difíciles por la pandemia. Gracias.
Thank you,
Les
Marcela.
agradezco y les felicito por esta iniciativa.
She says that thank you very much, and she congratulates all of you for this initiative.
Thank you so much, Olympia, for joining us. Mr. Diego, I see you had your hand raised for briefly a moment to give a brief comment before we move on to the next one, please. Thank you.
Olimpia, yo sé que es muy difícil, hay un montón de puertas y uno entra y está cerrada, otra está cerrada. Llámeme a Identity, el 301, tome nota, 301-518-8705, 301-518-8705. Vamos a trabajar junto con usted para buscar una solución para su hijo, ¿ok? Gracias.
Mr. Diego, do you mind saying that in Spanish for all of us to hear as well, please?
I'll say it in Spanish again, yes.
I mean English, I'm sorry.
No, I just mentioned to Olivia there's many doors, and some of the doors you open and there's nothing there. To call me, and we at Identity will help her and their son to find the right fit for her son. The county funds our case management program, and our case managers can help her find the solution that she seeks. Thank you.
Thank you so much. Thank you. Up next with a live question we have from Link Hoeing. Link.
Good evening, and thank you for the opportunity to speak. I just wanted to speak for the Fair Access Committee for the Western County briefly on mental health issues. It's something we've been very concerned about as a committee, given the isolation of Poolesville for mental health support in the county. All of you probably know the CDC released a report last week documenting the mental health crisis facing our youth, and the levels of anxiety, depression, and suicide have all risen dramatically, as we know. But here's the kicker. The report was finished in 2019, well before the pandemic. The report said even at that time that we needed 47 psychiatrists per 100,000 students, 4 times the number available in 2020. I think given all this and all the enormity we know this issue has, that we need to adopt a county policy of putting wellness centers in all of our high schools. I know personally that wellness centers can be a major help in addressing mental health issues among our young people. My son-in-law teaches at Northwood, and he says the health and wellness center there provides is integral. It's not just a part of their work. It's not a side part of their work. It's fundamental to their work. He says in the last few years, he's seen a steep increase in student behavioral problems, acting out, aggressiveness, among other problems. These centers are far more than glorified counseling offices. They develop real relationships with students, help support them with mental health activities of various kinds, and are a dramatic, important tool for teachers. Poolesville High School is now in the midst of reconstruction, as you know, and we're many miles from county services. Our last principal, Dina Levine, urged us to push for a wellness center, given the isolation of the school. But given all of this, shouldn't it be a priority to move towards incorporating wellness centers in all of our high schools? Only 4 have them today. Thank you for your time.
Mr. Hoeing, I'd like to respond to this. So as we speak, we are working on a proposal with the school system, with HHS, my colleagues and stakeholders. The PTA leadership has also been very involved. And the proposal is to establish wellness centers in each high school. Of course, we know that it's going to be impossible to have them built in right away, but we're going to have a short-term proposal, which means that there will be portables where you may not have the appropriate space, but the portables then will provide an opportunity. The school system would like to have some classes in the portable, but then integrate and build out and condition some of the inside space for the wellness center. And so we're moving ahead with that proposal. This is when I was referring to a bold response. We're in crises. We don't have time to wait, and do things incrementally. Secondly, we will propose a longer term approach so that through our CIP, we can then actually adequately build out the space as well. But we need to do this immediate response. And to the staff member that was talking about, the importance also for staff to receive some respite. And this is something that our PTA leadership did share with me. The idea is that these centers or these rooms, however you want to call them, Zen dens, whatever they are, would also provide that opportunity of support for staff as well, because we can't forget that. So I just want to, acknowledge that the school system has been extremely, collaborative in this effort. The requests will be coming in. And I know my colleagues like Councilman President Albornoz, Councilmember Joe Wando, they've been working, we've all been working on this for a very long time, Councilmember Hucker. because we understand that this is one of those examples of best practice that we know works. Started at Wheaton High School in 2016, and we know it works. So, so this is going to happen, and I'm really excited about this because, you know, as Councilmember Hooker says, sometimes the perfect cannot be the enemy of the good. I think we have something really good that we can do right away to respond.
Thank you for that. It's very much appreciated. I wasn't aware of all that work, but it's very good. Thank you.
Thank you, Councilmember Navarro, and thank you, Link, for your question and comment. Up next, we have a question in Spanish from Flavia Tello. This will also be translated by Marcela. Flavia?
Flavia puede dar su testimonio en estos momentos. Gracias.
Buenas noches. Bueno, primero que nada, mi reconocimiento y agradecimiento por abrir este espacio de diálogo sobre un tema tan importante. Ya lo han señalado, la pandemia, el aislamiento y el cierre de las escuelas ha tenido un impacto traumático en muchos de nuestros niños y jóvenes. Las personas que están sufriendo problemas de salud mental, y así como las familias que estamos acompañando estas crisis, enfrentamos múltiples desafíos al intentar conseguir ayuda profesional. Hay una crisis de salud mental, pero hay una crisis también de servicios de salud mental. En nuestro caso, con una hija adolescente con diagnóstico de depresión mayor y ansiedad social, tardamos casi un mes en conseguir una cita con un terapeuta y un psiquiatra. Todos están desbordados, muchos no reciben nuevos pacientes, y a eso se suma también el problema del idioma. Los servicios profesionales para la salud mental son insuficientes y las familias tememos que no lleguen a tiempo para ayudar a nuestros seres queridos. Quiero aclarar de todas maneras que hemos recibido la primera ayuda en el Crisis Center con una atención excepcional, pero lamentablemente allí no está el tratamiento a largo plazo. Por otro lado, en la escuela no se dan las alertas oportunas y preventivas a los padres sobre la condición particular de los estudiantes. Todo parece ser información general, funcionar en torno a los objetivos y estándares de la escuela, pero no de los estudiantes como personas. Finalmente, quiero señalar que el idioma es un obstáculo más en este proceso. Los recursos alternativos de apoyo a las familias, como los que ofrecen mayoritariamente las ONGs a través de los foros, de los grupos de apoyo, webinars, son siempre en inglés, con lo cual las familias hispanohablantes quedamos excluidas de estas oportunidades de aprendizaje. Recordemos además que el condado de Montgomery es una comunidad de importantes características multiculturales y multilingües. Entonces, mi recomendación o solicitud a las autoridades es, por un lado, ampliar y facilitar el acceso a servicios profesionales de salud mental, y si la capacidad en el condado es insuficiente, tal vez debamos pensar, esto signifique que habría que considerar ofertas y permisos de trabajo para profesionales extranjeros que además puedan ofrecer los servicios en otros idiomas. Segundo, facilitar que los recursos de apoyo alternativos cuenten con interpretación para que las familias puedan participar de esos foros, de las capacitaciones y grupos de apoyos sin condicionamientos excluyentes. Y tercero, siendo la escuela un lugar clave en la socialización de nuestros niños, adolescentes y jóvenes, y donde la prevención mejor funcionaría, sería recomendable que se incorpore una asignatura obligatoria sobre educación emocional de al menos 1 hora semanal para todos los estudiantes, y que se incremente también el número de psicólogos en las escuelas y que estos puedan ayudar a los padres, alertarlos de manera oportuna cuando los estudiantes bajen su desempeño o muestren señales de preocupación, como son el aislamiento en las clases, la falta de participación o no están haciendo sus tareas. Y en ese caso, ofrecer a las familias, al estudiante, acompañamiento y orientación a la familia sobre qué más se puede hacer. Muchas gracias.
Thank you for the opportunity you have given me to testify before you. Those who are suffering from mental health problems, as well as the families who witness this crisis, face multiple challenges when trying to get professional help. In our case, with a teenage daughter who was diagnosed with depression and social anxiety, it took almost a month to get an appointment with a therapist. Professional mental health services are insufficient, and families fear to not be able to find the help that they need for their loved ones. On the other hand, schools do not alert parents about the conditions of the students. They always provide standard information that seems to work only to work around their goals, but not in the best interest of the students. Finally, not finding information in our native language is another obstacle. Alternative support resources for families, such as those offered mostly by support groups, among others, are always found in English. As a result, Spanish-speaking families are excluded from these opportunities. These are my recommendations. Number one, to expand and facilitate access to professional mental health services. If the capacity in the county is insufficient, this could mean to consider hiring and creating new positions that would grant work permits for foreign professionals. Number two, make it easier for alternative support resources to have interpretation so that families can participate in support groups and training without exclusionary conditions. Number three, being that schools are a key place in the socialization of our children and where prevention would work best, it would be recommended that to add emotional education classes at least 1 hour per week for all students, and to increase the number of mental health professionals in schools in order to alert parents when something is wrong, and alert of signs such as behavior changes, isolation, lack of participation in classes, and more. And lastly, offer support and guidance to parents in order to find solutions. Thank you.
Thank you, Flavia. We have a couple of people here who are able to respond. First, I did see Viviana with her hand up and Diego as well. Go ahead, Miss Viviana.
Sí, buenas noches, señora Telo. Yo superviso la clínica de niños y adolescentes del condado y sé lo difícil que es entrar en este momento a recibir nuestros servicios, pero algunas de las ideas que usted nos ha dado me parece que las podemos poner en práctica, como ofrecer grupos de apoyo tanto para los adolescentes y padres que están en la lista de espera y no dejar pasar el tiempo. Así que mi teléfono es el 240-777-4303. Siéntase libre de llamarme y ver cómo podemos ayudar. Y si Diego tiene algún grupo en la comunidad, lo delego a Diego, pero cualquier cosa me llama.
Muchas gracias, muchas gracias.
Thank you, thank you. Diego?
Y Flavia, ¿cómo le va? Mire, para con su hija está en excelentes manos con Viviana. Para los recursos en la comunidad y con la idea que tiene de utilizar a profesionales de la salud de otros países hispanoparlantes, ya lo estamos haciendo. El condado ya lo está haciendo. Entonces, nosotros en Identity ofrecemos grupos, entrenamos a papás y a mamás como usted, muchos que tienen entrenamientos en sus países, pero otros que no, a tener grupos de apoyo comunitarios entre papás y mamás que tienen problemas bastante similares. Entonces la invito a que se una a nosotros, llame a Tomás, el teléfono de Tomás es 240-306-7188, ¿ok? Dígale que llamo de parte mía. Y ese es un programa que está financiado por el condado, es un trabajo excelente que usa la fortaleza de los papás y mamás de la comunidad para apoyarse, para salir adelante. ¿Ok? Gracias.
Thank you, Diego.
I just wanted to add to what Diego just said, señora Telo, también a nivel del Estado hay una propuesta de ley para formalmente poder certificar, como usted dijo, a personas que vienen de otros países que tienen esas capacidades, porque es tan importante tener ese tipo de recursos de profesionales que hablan el idioma, porque hay una escasez muy grande. So at the state level, there is a piece of legislation, I believe it's Delegate Peña-Melnick, precisely to be able to allow for the training and certification of foreign nationals, you know, and people who are here who come from their countries with that type of training, which is going to be really important because there is such a shortage of linguistically proficient mental health professionals.
Thank you, Councilmember Navarro. I see Mr. Davis and Dr. Kroll with brief remarks they would like to also give.
Sure. So I just wanted to share, I know part of her question had to do with supports for families also. And so I just wanted to elevate, I know we have a couple of individual follow-ups that we will make outside of our time together, but I just wanted to highlight several of our bilingual staff, particularly for our families, our parent community coordinators. If we're not familiar with those, really are the liaisons, homeschool liaisons for our families that all speak 2 or more languages. So I just think that's important, and we'd be happy to follow up with our parent here just to give her additional resources to help provide to any supports that she may need.
Thank you, Mr. Davis. And Dr. Kroll, did you have anything to say?
Just to add one more thing, and that is that in addition to Councilmember Navarro's comment about the state legislation that is pending around this, that we have in the county run the Welcome Back Center as part of our Latino Health Initiative that was designed, or we've supported, I should say, to work with foreign trained professionals who speak Spanish, Amharic, French, Haitian, all kinds of languages, to help them retrain, who've come to this country, to help them retrain and re-enter the helping professions, both health and mental health. And I think it's an example of what you're talking about, that because we don't have sufficient providers who are culturally competent and who speak the language, something that we are looking to try to grow and build support from the state so that we can continue to grow that model. I think the other reality for everyone here tonight is that given where we are in the country in terms of mental health professionals who are graduating and ready to go to work, and those numbers are down across the entire system. But therapists aren't the only thing that can be therapeutic, and we now have to think about other ways of building that therapeutic capacity into our systems with providers who may be not yet master's level clinicians, but who have skills to do a lot of the work and can be trained to do a lot of the work to support families and individuals, short of them needing to go to a therapist or a psychiatrist.
Thank you so much, Dr. Kroll. And that actually wraps up the questions and comments for this evening. We have actually run out of time, so I'm going to go ahead and toss it back to Council President Gabe Albornoz to close us out. Thank you.
Thank you so much, Jordan. So much to unpack tonight. So many great comments and questions. So much hope in the way of resources, and obviously so much work left to do in the way of building our systems and addressing the myriad of challenges that some of which we heard about this evening. I want to thank for my team, especially Beth Schuman and Lillian Cruz, who worked with our Public Information Office in helping to create tonight's very successful event. And this is not the end. This council is deeply committed to this issue, and will demonstrate through our priorities as were articulated tonight by my colleagues, and the expansion of the health and wellness centers within our high schools, bold responses to the challenges before us right now. I started a program in the middle of the pandemic called Let's Breathe. It was a little television show for 45 minutes that just focused on wellness. We have to give ourselves the grace to acknowledge that we don't have the answer to every question. We don't have the solution to every problem. But I believe strongly that working collaboratively together, we are going to come out of this stronger than we were before it started. I am confident of that. And I'm confident of that because of the professionals in the Zoom and the people of this community who have stepped up so many times in times of crisis and need. The president tonight will be announcing a major initiative, as we mentioned, because this is a national issue, but we're committed to addressing it here in our community. So thank you all again for tuning in this evening. We have a number of questions that we didn't get to tonight, but that we will respond to, and a survey that remains open that we want residents to respond to so that we can continue to have these issues before us so that we can address them in short order. So thank you all so much. Buenas noches. Gracias a todos por participar esta noche, and have a wonderful evening, and good luck to our president delivering the State of the Union tonight. Thanks a lot.